Serotonin Syndrome. Serotonin Syndrome, SS, is a potentially life-threatening condition resulting from excessive serotonergic activity in the central nervous system. It typically occurs due to the use of certain medications that increase serotonin levels, either through therapeutic use, drug interactions, or overdose. The syndrome can manifest with a range of symptoms, from mild to severe, and can affect various bodily functions. Causes. Serotonin syndrome is primarily triggered by medication interactions. The most common cause is the combination of two or more serotonergic drugs. This includes antidepressants like selective serotonin reuptake inhibitors, SSRIs, and triptans used for migraines. For example, taking SSRIs such as fluoxetine or sertraline alongside triptans can precipitate the syndrome. Illicit drugs and supplements. Certain recreational drugs and dietary supplements that increase serotonin levels can also lead to serotonin syndrome. Changes in medication. Increasing the dose of a serotonergic medication or starting a new one can also trigger symptoms. Symptoms. The symptoms of serotonin syndrome can vary widely, but generally include cognitive effects, agitation, confusion, hallucinations, and altered mental status. Autonomic dysfunction, rapid heart rate, high blood pressure, dilated pupils, and sweating. Neuromuscular symptoms, muscle rigidity, hyperreflexia, overactive reflexes, tremors, and myoclonus, sudden muscle jerks. Gastrointestinal symptoms, nausea, vomiting, and diarrhea. Symptoms usually appear within hours of medication changes or interactions and can escalate rapidly if not addressed. Mechanism. The underlying mechanism involves the overactivation of serotonin receptors, particularly the HTA receptor subtype. This overactivation leads to an imbalance in serotonin signaling pathways within the brain and peripheral nervous system. The neurotransmitter serotonin, hydroxytryptamine, is synthesized from tryptophan and plays crucial roles in mood regulation, digestion, and other physiological functions. When levels become excessively high due to drug interactions or overdose, it results in the clinical manifestations associated with serotonin syndrome. Diagnosis and treatment. Diagnosis is primarily clinical, based on the history of medication use and symptomatology. Treatment generally involves immediate discontinuation of serotonergic drugs, stopping all medications that may contribute to elevated serotonin levels. Supportive care. Hospitalization may be required for monitoring and supportive treatment. Medications. Benzodiazepines may be administered to manage agitation and muscle stiffness. In some cases, cyproheptadine, a serotonin antagonist, may be used to counteract the effects of excess serotonin. Conclusion. Serotonin syndrome is a serious medical condition that requires prompt recognition and intervention. Awareness of potential drug interactions and careful management of serotonergic medications are essential in preventing the syndrome. If symptoms arise following changes in medication regimens, immediate medical attention is crucial to mitigate risks associated with this potentially fatal condition.